a bacterium found in cleaning products from the IP brand, is resistant to most antibiotics and can be deadly for people with low immunity. Anvisa has ordered the recall of 24 IP brand products from the batch ending with the number 1 manufactured in Amparo, São Paulo. The reason? Contamination by microorganisms due to a failure in quality control. And the dreaded Pseudomonas aeruginosa was found in these products, a bacterium that is a nightmare in hospitals, because it is resistant to multiple antibiotics and can lead to very serious conditions and even death in people with weak immunity. In this video, we are going to talk about which people are at higher risk and 3 simple steps to strengthen yours. This video, not only do I need your like, it helps this content reach more people. Now more than ever, you need to share this with all your contacts, your groups, your social networks to warn people about this risk. And another thing, pause this video. Go check if you have any IP products with batch ending in 1. If so, comment down below. My friends, don't forget to visit my website. On my website, you'll find all the supplements I use, recommend, and that you always ask me about, like which is the best omega-3, what's the right dose of vitamin D, and which is the best magnesium. Everything is on my supplement list on my website. My courses are also there, along with my other social media, and very soon, exclusive apps for my followers, apps about health. It's easy to find me. Just type Dr. Moacir Rosa on Google and you'll find my website. Or you can use the QR code or check the video description. Pseudomonas is mainly a problem in hospitals. In these environments, the mortality rate from this bacteria is very high. It reaches 39% in cases of bacteremia, and it's impressive. 68% in ICU patients with pneumonia. It is also problematic for people with weakened immune systems. Transplant patients, HIV-positive individuals, people with autoimmune diseases, those undergoing cancer treatment, people with severe lung diseases, burns, especially the more extensive ones. We lose the skin's protective barrier, so we become much more susceptible to infections. So people with extensive burns also need to be very careful. And of course, those who are hospitalized, especially for long stays in the ICU. These people are the most affected. Elderly people also deserve attention. Elderly people have a weaker immune system. And pay attention to those who are using corticosteroids, especially if they use them for a long time. Corticosteroids, my friends, lower immunity. And Pseudomonas is an opportunistic bacterium. If it detects a failure in innate immunity, it will invade and cause enormous damage. Attention also to those who are using methotrexate and undergoing chemotherapy treatment. This also affects our immunity. Do you know what else weakens immunity? Poor sleep, stress, and low vitamin D. Poor sleep and stress increase our cortisol, which has the same effect as corticosteroids. Actually, corticosteroids are a synthetic form of cortisol, and again, it lowers our immunity. It lowers innate immunity and opens the door to opportunists like Pseudomonas. And of course, low vitamin D. Vitamin D is an immunomodulator. It strengthens our immunity. And people aren't getting as much sun. Vitamin D is produced in our skin through sunlight. And most people have low levels of vitamin D, which as a result brings their immunity way down. Vitamin D needs to be above 60 nanograms per deciliter. To achieve this, ideally, get sun every day, at least 40 minutes with your body uncovered. If you can't do that, you can supplement. But be careful, if you're going to supplement vitamin D, always use vitamin D3 along with K2 and MK7. Vitamin K2 prevents the calcification of the arteries because when we supplement vitamin D, we absorb more calcium. That's good because it strengthens our bones. But if there is no K2, and MK7K2 stimulates osteocalcin and GLA, which help with this fixation and help reduce immunity. If there is no H2 and no magnesium, another important supplement, both for immunity and for strengthening bones, is magnesium. This calcium ends up circulating, calcifying our arteries, hardening our arteries, and then you increase the chance of cardiovascular events. So the recommendation is keep your vitamin D above 60 nanograms per deciliter, always with K2 and magnesium. This will greatly boost your immune system. And of course, if you have IP cleaning products at home, throw away all the ones with a batch number ending in 1. Don't take any chances. My friends, check out my website. On my website, you can find all the supplements I use and recommend. My other social media are there. My courses. Don't forget to visit my website. And if you haven't subscribed to this channel, it doesn't cost anything, my friends. It's free. Just click on subscribe. Don't forget to hit the bell. Don't forget to select all. Share this alert with as many people as possible, post it in your groups, on your social media, send it in private messages. Pseudomonas is no joke.